Hello, everyone. Um, First of all, I am thanking you for this platform for giving me this chance. When I asked Dr. Shaji what I have to talk about, he said something inspiring. So today I thought which inspired me, I can talk here. So I can convey what I got from as a result of homeopathic medicine. When I was past first, I means when as a new homeopath, I don't have much experience. Just after passing the exams and all, we don't know which area it will work and all. So whether this is, can you see my screen?
No.
Sorry.
No, not yet. Not yet. You have to share it. You have to share it from.
Okay.
There is a green button to share.
Ma'am,
yeah, just a minute.
yes, ma'am.
Yeah. Is it okay now? No.
Not yet.
No, ma'am. Can you see the share screen button there, right? On
Yeah.
the yeah. Click that, and then a new window will pop up, and click what you want to share, and after that, click the share again.
Okay. Is it okay now?
Yes.
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 Okay.
Yes.
Yes. Yes. So,
Ma'am,
sorry.
ma'am, put that in slideshow mode so that everybody could see it.
Slideshow.
No, at the mid. Yes.
Yes.
At the top.
Ma'am, it's at the top. You can see that. Go to animation.
Insertion design.
Slideshow.
Next to animation, you can see home, insert, design, transition, and next to animation, you have your slideshow.
After insertion. No.
Go right, ma'am. Right.
Right. Okay.
No. Next beside your design, transition, and animation. After that, you have a slideshow.
Yeah, animation slideshow. Yeah, I got it. Thank you. Is it okay now?
Then go to the left and click from beginning.
Start from beginning.
Okay.
Now right. Yes. Now you can operate your slides with using your arrow keys. You have arrow keys, right? Use your arrow keys.
Yeah.
Okay, like that.
Is it okay now?
Yes.
Sure.
Perfect.
For going to the next slide then. Yes.
For going to the next slide, you can use your arrow keys for navigation. You can go back also using the other keys.
Okay. Is it okay now?
Yes.
Can you see it?
Yes, ma'am. You can continue.
Okay. Thank you so much. Okay. The case number 1. This case, it was our family friend. It was a cute family, one father, mother, and 2 children. And this father, he was working in Navy and got voluntary retirement and came back and settled in Calicut. These 2 children, they finished their degree, and the younger one, she went to take post-graduation in IT. She joined in Bangalore. And one weekend, she went with her friend to visit her home. Then from there, that was in Kottayam, and she want to go back to Bangalore. And these 2 friends, they're talking, and this patient, he get into the train, and they were talking each other. And when this train started, she realized that she's in a wrong train. So When the friend who is standing outside the train, she asked whether you can jump out of the train. She thought it is very slow. She can jump and land properly. But when by thinking that she had a very big bag on her shoulders, and with that she jumped out of the train, and she fell on the platform and had a hit on her forehead. Then she fell unconscious, and she was taken to the hospital, Pushpagiri Hospital, Kottayam. Then she was unconscious and taken to the hospital. She had a surgery. Big hematoma was formed and had surgery 2 times. Okay, to remove it, and ended up in unconscious state. Surgeon said she may be in this state for days or weeks or months or even years. And they put the tubes for giving medicine, food, and all things was through the tubes, and she took back to home. And but there was no change. They are expecting the patient like that for a long time. She was brought back to home in that state. When I saw her, she was in a water bed with the medication, food, as everything was given through the tubes. I had just finished my course and didn't have much experience at that time, and was not sure whether our medicine would be effective in a situation like this. I don't have any forefather or anyone in my family to tell me this will work or this is the action and all. We just finished the house urgency. Only the cases so from the hospital, that was the only experience for me. And I don't know whether this will be so effective. Then her parents requested me to try homeopathic medicine and see if anything can change this situation. Then they were ready to give medication, and I gave 1 dose of Hypericum 200 followed by Arnica 30, which was repeated 2 hourly. And I was not expecting this change, and just to give the medicine as her parents were requesting me. Okay, then next day there was nothing, but on third day I got a call from her father saying her daughter responded when they called her name. It was actually a shocking news for me. Surprisingly, I answered that phone call, and she became conscious slowly. But the sad part is they have to inform this change to the hospital, because they said whether any change for the patient, they have to inform to the hospital. And when they informed the patient is conscious, they said they have to take the patient to the hospital again, and then they want to continue the treatment. Okay. Unfortunately, she's still in that condition and continuing medication and physiotherapy and all. I didn't get this patient after that. Okay. And for the next case, that is case number 2, this man also from our village. He's a 55-year-old man. This case was also from my village. That's called Chemanjeri village. The man was trying to graze his cow. He held the rope on his hand, and the cow ran due to the sound of a horn. And pulling that rope with his hand tightly, when this cow was running, he was running behind him, that cow, and he fell down. Okay, and he became unconscious. He was rushed to Calicut Medical College and was diagnosed as cerebrovascular accident. From medical college, they suggested for a brain surgery, but that surgery could not conduct in the medical college. They have to take this patient to Sri Chitra Medical College, but the patient should take in without much movement. They should transport the patient to the medical college. So his son informed me about the situation, as my clinic was the only one homeopathic clinic in our village. I discussed the case with Dr. Abdul Latif, who was the superintendent of Government Homeopathic Medical College at that time. He assured me that we can treat the case if the patient could be moved to our medical college. For case study, me and my colleague, I think Dr. Madan Mohan, we went to the medical college. take all the case in detail, and uh, then that nurse, in that staff nurse, she helped us to see all the things and x-rays and all. There was so many small spots of blood clots in that x-ray, we can see that. And the patient was moved to Government Homeopathic Medical College with an ambulance without much movement. And the medication started from our college. It was like Arnica 30 itself repeatedly, and he became conscious. It was a very happy moment because it was a group work with us. And but there was a paralysis on right side, and there was some behavioral changes also was there for this patient after taking medication when he is conscious. Then that paralysis and all reduced by causticum 1 was the medicine given after that. Then I think we have, I know there are so many medicines with which many doctors are showing very fantastic results and all. But Arnica, I think we are especially me, thinking about this medicine whenever there is a mechanical injury or small injury and small ecchymosis or something, extravasation of blood, etc. But I never got results like this for the intravascular accident cases. I know very famous personalities are there in front of me. They have so many experiences to say about these things. Arnica sphere of action, the chief action of Arnica is in blood and blood vessels, particularly on capillaries. It possesses the power of lytic action and help to absorb the blood. That was the action we saw in the first and second cases. Pathogenesis of Arnica: by its action on blood, it produces anemia, tendency to hemorrhage, capillary stasis, ecchymosis, and defective nutrition. Arnica causes reabsorption of extravasated blood, prevents septic condition and recovery of the parts. On the muscular, serous, and cellular tissues and tendons, it produces conditions similar to those resulting from blunt injuries. Constitution of the Arnica: physical makeup is sanguine, plethoric persons, lively expressions, and very red face who are disposed to cerebral congestion. Mind: it is unconscious when spoken to answer correctly, but unconscious and delirium returns. And he says there is nothing matter with him. Dr. Ken says, like, even though the patient is very tired and very in the last stage of his condition, even though he says, I don't have any problem. And says there is no need of doctor. I don't want to see doctor. Okay, this is the mental condition of the Arnica. It is very much effective in the nervous system. In the nervous system, that is the as a side effect or the after effect of injury, there can be a paralysis of single parts or different parts, especially that is left-sided paralysis. It says paralysis of the whole side of the body, etc., or the face or the leads or a single part like that. And also there is a bad effect of injury. Then the hemorrhages in the eyes, mechanical injury, effect of mechanical injuries, congenital or retinal hemorrhages. When we are thinking of the female reproductive system, we gives medicines for preventing the hemorrhage after the after delivery, and also for lacerations of the soft parts, etc. We are giving Arnica. And extremities, gout, rheumatism, etc. I think in this case, the patient is so sore. They are saying about so no one can come near to him because it is so sensitive. He fears that someone will touch there. It is so sensitive pain. And action on nervous system, we already says. As a prophylaxis, we give Arnica in the case of tooth extraction to prevent the bleeding before and after, and also in the labor, we already said about it. But I heard one talk from Dr. Vitolka, Dr. George Vitolkas, like he's saying, we can't give arnica as a prophylaxis in the case of we expecting bleeding tendencies, like before a tooth extraction or before labor to prevent the bleeding. I think I need answer from the famous personalities in front of me, what they are thinking of it. But in keynote, read somewhere like we can give this medicine to prevent the hemorrhage. I am not a person to answer this question. And so thankful for giving me a chance of presenting my case. And over to you, Dr. Shaji. I need an answer from big personalities like Dr. Ismail said about my question also.
Okay, thank you, Dr. Rajani. And now I hand over to Dr. Ismail Said sir. Said sir. And answer the question. There is a question to you.
No, she's a brilliant student. That was studying in Lamar College. Very brilliant student, and he was a good dancer also. I also made some opportunity to dance international in the university programs. She got first prize and something at that time. She's very short to in the classroom, always very keen attention. That's why she was got this much of effect of this medicine. But arnica we can give to any case wherever the hematoma was formed. I was sitting in my neighbor, one Manoli Kadar. And Manoli Kadar was Badallo. It was better than from the platform in the veranda, unconscious. He got the 1.75 milliliter of blood in the base of brain, and they are not able to even remove by surgically. It's very critical state. That was that time I was at Dubai at his born brother-in-law's house. I'm staying there. So Mohammed told me my brother-in-law is having this much of complaint. What to do? So I rang up my phone to my brother, Calicut, ask him to give the medicines. But night by 10 o'clock, he was started the arnica. Sip by sip. Morning, he asked him for the tea. And the man who ended up with the hematoma is asking for the tea and he would sleep. And I think he was dead due to cardiac arrest last month or day before. That means he was lived under 15 to not 15, 17, 10, yeah. It was on 80, 87 or 88 happened. So arnica is a very wonderful medicine. Wonderful medicine about the preventing the bleeding as well as resolve the frauds wherever it occurs. Yeah, I used to practice with that. So very good result it was shown for inspired juniors. Thank you very much for your class.
Thank you. Thank you. Now I wish to go to the question and answer session. At the same time, while somebody, I request those who wish to ask questions or wish to make comments, go to the participant list and raise your hand. Now I invite Dr. Joe Saison.
See what Dr. Rajani Palakkal has said. I would like to comment on two things. One is about the arnica before extraction. Actually, many people are giving it. I also have given it several times. What I do is I give 1 dose of arnica before tooth extraction, and after tooth extraction 2 or 3 doses. It prevents the bleeding. It prevents the edema and a lot of pain also. Found very useful. And another remedy is Staphylococcus aureus. Then regarding the case which she said about Costium,
Yeah.
and arnica.
Yeah.
Actually, in many stroke cases, I have tried this arnica because in the beginning, we don't know which side is affected. Either the right, we don't know in hemiplegia.
Yeah.
And usually I give arnica. And once after 3-4 days, we are very sure about which side is affected.
Yes.
Left side, I usually give arnica or lachesis. And
Yeah.
if it is right side, I am giving causticum.
Yes.
And I told this to many doctors in Europe. And there are some doctors who who is working in the emergency department of the hospitals.
Yeah.
They tried it and they told me that it's very effective.
Okay.
So in stroke and hemiplegia, usually I am using only these 3-4 medicines: arnica, lachesis, causticum. Arnica in the first stage itself, because we are not sure which side is affected. And anyway, it helps to dissolve the clot or to remove the thrombus or whatever it is, which causes this hemiplegia. And it works very well. So what you have done is very good. As a young homeopath, you have a great future. Thank you.
Now I am not young. At that time, we did.
No. Anyway, your prescription was correct.
Yeah. Thank you. Thank you so much.
We can see the potential in you.
Okay.
Next, I go to Dr. Sridharakurup, sir. Dr. Sridharakurup, sir, unmute from your side and speak.
Thank you, Dr. Rajani. So
Thank you,
I
sir.
appreciate your efficacy to solve such cases. First, I appreciate that my experience, I can tell you. I maximum used arnica after injury. Then injury that which blood may not come, that not open injury. There are so many cases. Now also at present, I am having one case in Chennai. I am having so many cases. I got one of the best result and good reputation with arnica. So many, about 3 months back, I got one case from Chennai itself that he met a small accident and he was not able to, he tried allopathy, Ayurveda and all these things, but he was not able to. I asked that him to take arnica, that I was asked him to put a bandage, putting always that to put the mother finger mixed with water, and he continued. With 2 weeks, it was completely cured. He was able to write. Now also I am having another case in that is also in Chennai, that it is better now, not cured completely. While he was walking, he slipped that one side, and the gluteal part that it is injured. He couldn't get a relief. Now I am given already 30, but it couldn't help. Now 200 better, but not completely good. I got very good reputation with that this arnica. I got very good result. That another thing that I gave that in delivery. Before that, some ladies may come and ask that whether what I can take some homeopathic medicine or that. I would always give that arnica 30. Some sisters from Germany, I got a chance to meet them while I was in Udupi. Then I asked that they are not allowed. But I told that you keep 1, 2, 3 number like that. So one, I was giving always aconite, number 1. Number 2 was arnica, aconite before, because to avoid fear for that, or the even child also will get avoid to the injury to the mother, and the child also will help that the arnica before delivery, if you may give. That is one of the best remedy I was prescribed, and all got relief and result also. That is my experience. Thank you. But what I also heard that one letter that Dr. Vidorkas was telling, you must not give that arnica. It is absorbing to the clots, not for bleeding, it will not, but it is not correct always. It may not correct. Of course, he was a very reputed man. He was one of the best teacher, but sometimes it can act because if Persatla is amenorrhea also it is good, but metrorrhagia also is good when it's mental and physical and emotional symptoms suit for that. So likewise, arnica is useful for both bleeding as well as to the absorption of the clots. What I feel so. That is my experience. Thank you very much.
Thank you, Dr. Sridhar Kurup. And next is Dr. Hubert. Dr. Hubert.
Hello, doctor. I'm fine. Your talk was fine. What I want to say is something related with head injuries. Every head injury is a serious one. We should always remember it. The bleeding condition, concussion, contusion, and everything all of you know. But we have to find out whenever there is a head injury, we have to find out the what extent it gone. Otherwise, we are treating with the patient is sometimes it may be very dangerous. We know that 20% of the blood, if it is gone, then it will be any time it may happen, shock, it may happen. Even in Indira Gandhi's death, that time the medical report was, we know that 29 bullets were he had shot, but
64.
only, how much?
64.
64. But the
64.
but the medical report was her death was due to shock.
Yes.
Many people were that time, why? She was shot dead, but the doctor saying that she died with shock. That is 20% of the blood whenever it may lose that time. Then another condition, what I want to say that in such conditions, we natural self, we use natural self 10M or high potencies, and arnica, I think that it is better to use higher potencies.
Okay.
1M and everything, it may get sudden relief from pain.
Okay.
And another thing I want to say, natural self and there is another thing that in hematoma, inside the head, there is blood clots and everything, anything that happened. In that time, it is useful calcarea carb ornum. Calcarea carb ornum will, calcarea carb and calcarea floor. Higher potencies and lower potencies will dissolve the clots.
Yes.
I had a history. I had a girl came to me for continuous fits. She is a 25 years old fits. Here very often coming. That time they sent to Sri Chitra Medical Center, and they cannot even touch the case, and they sent them to the Indian Institute of Medical Science. But within that time, they were planning for to go there. Only 2 weeks I got. 2 weeks time, they called me to say, you can do anything for this. We have to do an operation. There is a laser therapy, laser knife therapy.
Yes, yes.
Laser knife therapy only. Otherwise, she won't leave. If it open, she won't leave. Because the lateral side is very much affected. That time I had given arnica, calcarea carbon, calcarea floor, and natural self. In addition to that natural self, within 2 weeks, the doctors were astonished. They cannot see anything in the, I can show you I have the, for X-ray and all the reports, MRI reports are there. That clot is completely gone.
So, yes.
Her fits completely gone. She is now married and she is having now, she is in her family way. Thank you very much. This is the experiences I had. And arnica is very much useful. But I am also, Sridhar Gurupasa, what said, I am also agreeing with him that arnica has some, in such conditions, it is very much useful in even it getting clotted. Okay, thank you.
Thank you,
Okay, thank
Dr. Hubert. Now it is Dr. Beatrice Jessner from Germany. Dr. Beatrice.
Yes.
Hello, I'm speaking from Germany, and thank you very much for the two interesting cases. For me, it was impressive that only with Arnica 30, you could get such a result. Like here in Germany, we would have given 200 or 1M, like this.
Oh.
And yes, so impressive. After 3 days, you felt no reaction. After 3 days, responding to her name. Is that right, huh? And also very nice, you did, for me, you did not expect that you could help.
Yes.
Give a great help. And that was so special. So it also shows to us, that there's not placebo. You were not expecting the person sleeping, unconscious. You give the remedy, nothing else was done, and you get such a reaction. So congratulations for that experience. And you were asking about prophylaxis of Arnica, and you were talking about Dr. George Vizulkas, saying we should not do this. I'm not sure whether he meant that in such a strict way. And I can tell you that here in Germany, we are used to give prophylaxis for every kind of operation. So homeopathic doctors, we do that. If it's a small tooth extraction, you can give, I do it like this. I give C30, Arnica C30 before, 1 hour before and 1 hour afterwards. Okay, and if there are normal operations or bigger operations in the abdomen, other parts of the body, my patients will receive Arnica 200 after the operation for 2 or 3 days. And at the 4th day, I will give a Staphysagia 200. That's my way of treating. And to explain as an interesting case, I can tell you that a man about 84 years old had to be operated at the heart. There had to be a tube has to be repaired. We say a stent. I don't know whether you understand. He needed a stent. Yeah. Okay, so the family phoned me before and said, "Doctor, can we do something? Can we support?" I said, "Yes, please take Arnica." And because it was a stent in the heart, I said 200 before and afterwards. And they phoned me back 1 week later, everything is fine. And they told me the following story. Listen, in the same bedroom, there was another patient with the same operation, also getting a stent. That patient on the thorax afterwards, totally blue. I didn't have anything. So the nurse said, "What happened here?" And he said, "Yes, we did take some Arnica." And so in Germany, the doctors in the operation rooms, they more or less know if there are patients who are taking Arnica, it's getting better. And even I receive recordings from the doctors in the hospital telling the patient something was very good in your recuperation after operation. What did you do? Arnica. And talking about the head injuries, you seem to be a bit in that topic with head injuries. I would agree with the other colleague that natrium sulfuricum is a very important remedy. Yeah. Okay, a very important remedy. And I could tell you that I had a very special situation 1 year ago of a lady who got operated on the head for a meningioma. Okay, because she was a bit dizzy, not many symptoms before. She got the operation and she started to have headaches after the operation, weeks, months. So the daughter was in my office and telling about her complaints. I was asked, "Do you have any stress?" Okay, she said, "Yes, I have stress. My mother is so bad. Imagine, doctor, she has now heavy headaches since 7 months and nothing is helping." Okay, so I did something I normally don't do. I said, "Okay, I give you a remedy," and I gave natrium sulfuricum 200, okay, to give to the mother. And the mother did take the remedy, and the daughter said, within 3 hours, the headaches went away for 10 days. Yeah. After 7 months. So after 10 days, she phoned and we continued with the Natrium muriaticum. And this case also is beautiful in that form. She did not know me. I did not know her. She did not know homeopathy. And it helped without anything being in the subject. And so I was already talking in Lisbon or other places, presenting that case as a proof that is not a placebo. That woman could not be placebo. I did not see her, she did not see me. But for you to express that natrium sulfuricum is a very, very good remedy. Not the first one, but the second or third one. I don't know whether the colleagues of India will agree about that, but that's what I've had as an experience last year in my practice.
Okay, very good, very good. Yeah.
Thank you.
Thank you, Dr. Beatrice. And next is Dr. Manoj. Dr. Manoj.
Thank you, Dr. Saji Kudiyat, for giving me an opportunity to participate in the discussion. Very nicely fading through the path of truth. And I think what Hanuman did was he collected a lot of information from the local persons. And there was an essay in the lesser writings said that there is always something in old woman saying. So he collected a lot of from the surroundings, and he got the clue from millifolium that is traditionally used in Germany. So many informations are there. That is the reason. Then I think there are a lot of cases. My father was a homeopathic physician, and he had a passion for treating these stroke cases. A lot of cases are there, hundreds of cases he treated. I think he used the medicine as arnica, rustox, causticum, then lachesis as sulfuric acid were used. But what happened is that unfortunately he died of stroke at last. He got an injury, subarachnoid hemorrhage. None of the medicines were acted. That's a very sad thing what happened after a few years back. Then I would remember another case is that one of my friends, when his mother was got this cerebrovascular accident, and they diagnosed a stroke, and they referred the patient to the Sri Medical Center Trivandrum. So during the journey, he gave arnica repeatedly. Then at last the patient came to the OP. Then the doctor examined. They asked the patient to bystander, who told you that you have stroke? You have no problem. Within 2 hours, this happened. Around 20-25 years. So our medicines are really wonderful medicines. What is needed is our effort. That is more important. Then another medicine, I think Secute is another medicine for brain injury to brain substance after surgery. Secute is an important medicine. Anyway, nice presentation. Thank you for coming to our coming and participating in our platform. We are inviting all of you for regular attendance in your platform. Thank you.
Thank you, sir.
Thank you, Dr. Manoj. Next is Dr. Abraham Vaidya. Dr. Abraham Vaidya.
Greetings to all, especially Dr. Rajani, with a short presentation of 2 cases. Discussion.
Please unmute from your side, Doctor. Dr. Abraham, unmute from your side.
Yes, I unmuted.
Okay.
I am audible?
Yes, audible. Yes.
Audible?
Once again, now it is audible, yes.
Okay. Greetings to all. I congratulating Dr. Rajani for the nice presentation. Only with the 2 cases, she created a very good discussion environment. For the first case, I think that is the best case for discussion, because she made some improvement with arnica, but the hospital fellows taken up the case and destroyed the case. That happening in many cases. And second case also done very well. And she started the presentation, but Dr. Beatrice from Germany done a very good job. She encouraged all of us with her many wonderful experiences. I think she may give more experience to us. About telling of Arnica, in my presentation some months back, I presented that we have to inform the public that the Arnica is suitable and best medicine for accident cases, cerebrospinal accident like that. After aconite, Arnica is the best one. If the common people is aware of it, they will use it and homeopathy become more popular. That was my topic in that time. Now, I experienced that for COVID treatment, the Arnica is playing a very good role. I'm treating many cases of COVID cases, which are admitted in the hospital, ICU, etc. Without the knowledge of the authorities, I'm giving medicine, and this helps a lot. Actually, one of my senior doctor, Dr. Seena Sudan, who she told about this effect of Arnica in COVID cases. You see that the clots are the main causes for many death and for the serious going places. So such cases, if we give Arnica 2 or 3 doses, that thing will be removed, that clots will be removed, and the patient will improve within a day. That's a wonderful experience that I got. Now we are, most of all us doctors are facing the COVID cases. This point is very important. Again, in retinal detachment, I got many results from Arnica. Retinal detachment, wonderful results from Arnica. For telling about other remedies, after cerebral spinal accidents, especially bothrops plays a very, for right-sided affections, bothrops plays a very good role. And that's not the matter to discuss here. So we are discussing about the Arnica. And so I'm concluding. Congratulations, Dr. Rajani, and moreover, Dr. Beatrice, for your share. Thank you all.
Thank you, Dr. Abraham Vaidyan. Now, Dr. Kamal Shah. Dr. Kamal Shah, please unmute from your side and speak.
Thank you, Dr. Shaji Gudiat. Good evening to all participants tonight. I'm from Malaysia. I just would like to share with all of you what happened in 1992. I studied homeopathy in 1979 with Professor Dr. Dali, who was the president of the Malaysian Homeopathic Medical Association. And he was the one who sponsored me to study in India a few years later. After coming back from India, I came back to Kuala Lumpur and started moving to Kelantan, which I'm residing now in Pasir Putih, which is about 530 kilometers away from Kuala Lumpur. So one day in 1992, I just had the notion like, I want to give a call to my professor. So I gave a call to his clinic and was told that he is in coma in a hospital in Kuala Lumpur. I panicked, you know. I mean, he was my guru. He was very dear to me. I didn't know what to do. So I gave another call. I called another doctor, Dr. Raji Johari, who was in Kota Baru, Kelantan. And he advised me to take 3 medicines to go along and see what I can do. So I took with me Arnica 30, Natron South 200, and Opium 30. I was in panic. I drove down to Kuala Lumpur. It was about 8 hours drive to Kuala Lumpur, and only the next day I could go to the hospital. When I arrived, he was already 9 days coma, in comatose condition. No movements at all. I met with the doctor who treated him. He was a Sri Lankan MBBS doctor. we discussed and I asked permission to treat Professor Dali with homeopathic medicine. He denied. He refused to let me treat Dr. Dali because at that time, the blood clot was already 70%. Sorry. The blood clot was 70% already. And he says he doesn't even have 50% chance to live. I stood beside his bed, praying to God, please help me. I couldn't decide at that time what medicine to give. Should I give him arnica or natron salt? He suffered this when he was about to go to his clinic 9 days before. In the morning, he went to his gate, opened his gate, and as he turned around to get back to his car, he stepped on a pebble and just dropped just like that on the head. He was a very robust man, very tall, very staunch, I just prayed to God. I said, God, please help me. Please guide me this time. Please guide me. I need your guidance. What to give? And about 15 minutes later, I decided to give natron salt 200, one drop in his mouth, without anybody looking, I made sure that no nurses was looking at the time, no doctors were around. So I just opened his lips and put one drop of natron salt, 200, and waited. 20 minutes after giving him the natron salt 200, I heard him cry out, just like that, just like that. So I called him. I call him father, I call him Bapa. I said, Bapa, can you hear me? He said. And he opened his eyes. Slowly, he opened his eyes. And I said, can you hear me? He said, where am I? I was on his left side. He turned to his left side and he saw me. And tears started coming down from his eyes. He saw me. We all cried, me, my wife, and Dr. Dali. You recognize me? That's all he could say at that time. So at 12:30 in the afternoon, his wife came because it was visiting hours. His wife came. I gave arnica and natron salt. I just gave one globule of natron salt and a pill box of arnica. I told the wife, tomorrow morning, you give him this natron salt one more time, and for the next consecutive days, please give arnica 30 TDS. So she did that. And after a month, he fully recovered. He could walk. We were also very happy, after 1 month. There was no blood clot. It all dissolved within a few weeks. So that is my experience. It's not the only experience, but that is my biggest experience, my biggest success in treating CVA. Thank you, Dr. Shaji, for giving me a chance to share my experiences. Thank you all.
Thank you. It was a nice presentation. So we need to wind up. Before we wind up, I wish to make a congratulations.
No. You hearing me? You hearing now?
Said sir. Okay, sir. Okay, sir. Yes, sir.
It's okay now?
Yes, sir. Yes, sir. Tell me, sir.
Something. Everyone shared the very miraculous act of the Arnakya. Now I am going to share a disagree with Arnakya. One thing. Those who are doing it and be careful of those. Suppose that the road accident is very quiet now, no? There is no very huge road accident. Suppose anybody from the road accident lacerated scattering injury in the all over the body. Paint
Yeah.
That's a condition. Suppose we are giving arnica to separate. All the wound will separate. There you can think about the sulfur 1 amount 10 amount. You want also. If need, after 2 days, calendar 200 can train. So arnica, very good medicine in all aspects of the trauma and the injury, everything there. But in injury, not actual injury, lacerated wound. Suppose we are giving arnica, it will separate the condition. Words will become worsen. And modern doctors are accusing us due to the homeopathy it was happened like that. So don't give any arnica to that condition. Give only and also sulfur 10 ml. It's enough and more. Suppose you need more support. You try calendula 200. That's all. After tooth extraction, also we can give the arnica 1/10, 1 drop divided into 10 doses. Give 1 hourly. That is before the extraction. That's after the extraction. After 1 hour of extraction, every hour. The 10 doses enough for all the conditions. No need of any antibiotic. No need of any anti-bleeding. Here the Calicut, so many allopathy doctors are dentists are recommending this one. And they are asking whether you have got the set powder. Dr. Set powder you have, and try that one. That's all. Then they agree with that. Arnica 200. Thank you very much.
Thank you, sir.
Thank you. Also, I wish to make a small suggestion of giving bellis perennis for visceral injuries or abdominal injuries after surgery or after accidents. That is the very wonderful remedy, bellis perennis. And I wish to make an announcement to congratulate our Turkish group who already completed the first group. We started with them. They started second group of IFPH. And that is a great work they have done. I congratulate them for that. And all the IFPH group under the efficient coordinator, Dr. Sevji Postlo, who is our daily attender of our Zoom conference, Zoom meetings, deserves all congratulations along with all other group members. Other coordinators also. So I use this opportunity to congratulate them for efficiently bringing more people from Turkey, very actively working, coordinating, and bringing lot of enthusiasm within Turkey. And we also received the news that there was COVID-19 treatment, homeopathy was allowed in Turkey. These are all great news from Turkey. And in coming days, we will be starting a special session in English translated to Turkey in IFPH platform. And we will be giving a special appreciation to her, showing a lot of enthusiasm, interest, and dedication to homeopathy. And that's another announcement I wish to make now. So with this, I like to conclude the session. I wish to, I think Dr. Sevji Postlo is with us today also. I wish her to come forward and say a few words regarding the success of completing one WhatsApp group. Dr. Sevji, please say a few words. Unmute from your side and say a few words.
Okay. Thank you very much.
Please unmute yourself. Where are you? Yeah, thank you. You are very regularly visiting and participating our sessions. Congratulations and best wishes for more future activities.
Thank you very much. We were happy to be in IFPH, and I am very happy connecting all of our friends this I want to be at the same time connecting this session and learn much things about homeopathy and applying of homeopathy. And we learn a lot of things, your experience. Thank you very much.
Thank you, doctor. Thank you. So now I invite Dr. Manoj to say a vote of thanks. Dr. Manoj.
Thank you, Dr. Shaji Kudiat. Very nice topic, and the discussions are even better. So this is a very important thing, and we can manage a lot of cases with the cerebrovascular action syndrome. The allopathic medicine was really suffering to curtail the problem, and everyone is really is in danger of getting a stroke due to the tensions or the hypertension or so many problems. So homeopathy is really, it can offer to the world that we can reduce the attacks of problems. So very nice presentation. So on behalf of IFPH, I express my sincere thanks to Dr. Rajani Palakkal for your nice presentations, and also to those all who participated the program as well as the discussions and the backend team of IFPH. Thank you once again. Thanks for all.